Welcome to Mount Sinai Live. We stream smart healthcare information that's simple to understand so New Yorkers can improve their health. I'm Jimmy McKay, and I'm your host. Today we're sharing things that every parent should know about concussion. And for the audience, remember, if you have questions or comments during the live stream, feel free to drop them in the comments below. Now, to help us understand more about this topic is Dr. Jenna Tosto-Mancuso, a physical therapist who is a board-certified clinical specialist in neurologic physical therapy, as well as the clinical director at the Abilities Research Center here at Mount Sinai. Dr. Tosto-Mancuso, welcome to Mount Sinai Live.
Hi, thanks for having me, Jimmy.
All right, let's jump into this. Parents wondering what they need to know about concussion for their children. Let's start with what happens to the brain during a concussion.
Absolutely. So it's a great place to start. There's become a lot of attention around concussion, and the term has become more commonly used both socially and just in general. And so I think it's helpful to understand what actually is happening in a concussion. So a concussion is technically defined as a type of head injury or brain injury. And what we find happens with a concussion that is different than other types of head injury or brain injuries is there is not one focal or location-based injury to the brain, but rather a more global injury to the brain where there are changes in responses of different type of chemical messengers called neurotransmitters, different changes in the communication pathways in the brain that result in changes in presentation and the development of symptoms that are different from what your child might normally be experiencing.
All right, so let's shift over to how. How might a child get a concussion during sports or during play when they're out there doing things that kids do?
Sure. So by definition, when we think of a concussion, it's typically the result of rapid movement or changes in head and neck positioning. So for instance, if a child is playing a contact sport and they are tackled or they are moving really rapidly and their head hits the ground, essentially if we think of the skull encompassing or the skull holding the brain, that rapid movement called a coup counter coup, either forward or backward or side to side, can cause a concussion. And so this can happen again if a child is playing a contact sport, they're tackled and they collide their head or their neck with another team member, or perhaps as they're being tackled, their head or neck is then making contact with the ground. Or in other instances, if they are playing a sport that involves, for instance, soccer, where their head is coming up and hitting into a ball, right? If we think back again to this idea of head and neck shift that are moving in a rapid acceleration, deceleration, so rapid movement and then stopping pattern, that typically is the cause for concussion, particularly in sports.
Okay. All right. So let's arm parents with some really good tactical information, basic information to identify a concussion. What are some common signs and symptoms they should be looking out for? If a parent's seeing these signs and symptoms right now, what should they do with that information immediately?
Sure. So signs and symptoms of a concussion. Typically, after a concussion, there are symptoms that will come on immediately. Oftentimes, we see a degree of disorientation. So your child may just not appear like themselves. They may not be aware of their surroundings. They may have lost track of time. So oftentimes in a sports situation, we may ask a student athlete or a child, what quarter are we in? Who was the last team to make a play? Just general disorientation and confusion. They may report onset of headache. Blurry vision or double vision can be reported. Nausea can be experienced. What differentiates a concussion from other types of head injuries? It does not require, in order to be defined as a concussion, there is not a significant loss of consciousness. So there may be a brief loss of consciousness, but ultimately your child or the child may be come up, they might walk off the field, they may appear okay, but just really, again, that disorientation component. So in the immediate moment, those are all things we want to screen for. Other things we might be looking out for are changes in balance or the way that they're moving. So they might appear that they can't keep on their feet, that they're moving side to side or swaying abnormally, all things to look out for when we're thinking about how do we immediately look for or if we suspect a concussion.
That's good information. I just want to review because I think this is the important information, right? So disorientation, maybe some lost time, confusion. You had mentioned maybe the presence of a headache, blurry or double vision. nausea, and maybe a loss of balance. And this, I think, was the big one. This was when I was growing up anyway. If you didn't lose consciousness, it definitely wasn't a concussion, right? So not necessarily. So you may or may not have lost consciousness, but it still could be considered a concussion, right?
Precisely. And I think as we've, especially in the past 10, 15, 20 years, concussion research has come so far. And what we've really started to understand is that what might have previously been called like a stinger or a head hit that may have been dismissed previously, we now recognize that those symptoms are consistent with a concussion, and we have a more serious matter on our hand than a matter of a student athlete or a child just simply walking it off and getting back to play right away.
Yeah, getting their bell rung or just walking it off
Exactly.
was things we used to hear, and we hope we don't hear those things in the future because we know more. Now, if a parent thinks their child might have sustained a concussion, if they heard what you just said and now they're saying that's on my checklist and they've experienced that, what should they do in the immediate time after that incident?
Sure. So immediately after a suspected concussion, it's absolutely appropriate to bring your child to the emergency department. Our teams in the emergency department are trained to evaluate concussion symptoms. We always want to rule out any more serious diagnoses. So absolutely appropriate to bring the child to the emergency department in the immediate moment. We also want to make sure that we're following up with their pediatrician. And then we want to make sure that if there is in fact something going on from a concussion standpoint, and we've ruled out anything more serious, that we are starting to think about care planning to make sure that the child is able to get on the road to recovery as quickly as possible.
Okay, so you bring up something that right there. This is an emergency situation or potentially emergency situation. So going to the emergency department is completely in your checklist if you were seeing some of those symptoms. You also brought up some other healthcare providers. It's always good to know your resources. Who are the people within the health system that can and will be able to help your child with a concussion?
Sure. And so, as I had said earlier, concussion has really developed in the past. Concussion research and concussion clinical care programming has really developed in the past 10 to 20 years or so. And we're seeing more and more health systems like Mount Sinai start to develop comprehensive concussion care teams. And so, who is on the care team? Generally, we work very closely with physiatry or rehabilitation medicine and sports medicine. So, those individuals can serve in the medical capacity for providing evaluation for our patients, making sure that from a medical standpoint they're managed. Other team members might include neurology. Our neurology colleagues are incredibly helpful, especially from managing the medical end of things for, as we said, concussion is considered a type of head injury or brain injury. If your child is experiencing symptoms that are consistent with visual disturbance or double vision, changes in vision, neuro-ophthalmology, which is a practice of ophthalmology or vision care specific to the neurological system, they're very crucial as well as assisting with the vision end of care. And they can make referrals to someone who's called a vision therapist. So there's actually a subspecialty of both occupational therapy and physical therapy that focuses on vision. Other members, speaking of our rehab folk, I am a biased party here, but we also have our rehab team, physical therapy, occupational therapy, speech and language pathology or speech therapy. All of those team members are pivotal team members for the day-to-day rehab of an individual after a concussion, working really closely with our medical colleagues, again, physiatry, sports medicine, neurology, orthopedics as indicated for cervical spine or neck injury. Really what we want to think about when we talk concussion care is building a team around the child so that all disciplines are, number one, addressing the very, very crucial components of a concussion, but working together to make sure that there's a cohesive plan of care for the road to recovery.
All right, so good information there. Now let's talk about time frame, right? So I think we're going to hear it depends maybe somewhere in here because each situation is going to be different. But if a child has a concussion symptoms and they're not improving, what's a good time frame to do something more? Maybe seek out some more resources, and what would some of those resources be?
Sure. So again, I go back to the literature, and really there's been a huge push and a realization that for children and for individuals who sustain a concussion, participating in rehabilitation as soon as possible has actually been demonstrated to have optimal effects, have better outcomes in the long run than individuals who wait. And the reason for this is we want to get ahead of those symptoms progressing into something more long term. What can happen if symptoms are not addressed early enough on is that we go from this initial acute injury of the concussion to what's called post-concussive syndrome. And so post-concussive syndrome happens when we have symptoms that are lingering and are not addressed. Typically, we say after the 21-day mark or so. And so we know that if we start to address those symptoms prior to the 21-day mark, whether that is a vision symptom, a vestibular or a dizziness symptom, pain, cognitive changes. I think that's important to mention as well. I've been talking quite a bit about those physical symptoms, but also cognitive changes, changes in ability to focus in school, returning to learning, things of that nature. We really want to get ahead of those symptoms early on so that we prevent them from becoming longer term symptoms in the long run of recovery. It makes it a bit harder to address those symptoms in the long term.
So that mark being that 21-day mark, that post-concussion syndrome, is something people should take note of. A parent in the New York City area has a child that they think has sustained a concussion. What can they do today with Mount Sinai if they're in the New York metro area? Where should they go to access care? What are some places that you'd send them?
Absolutely. So here at Mount Sinai, we have a concussion care program. It is a comprehensive program where it includes all members of the team that I had previously noted. That center is through our Charles Lazarus Children's Ability Center. We're based out of Union Square, but we do have satellite sites throughout the city. And so we definitely encourage families, if you are working or you or your child has a concussion and we're in need of those follow-up resources, it definitely can be a great opportunity to get in and get care as soon as possible. Additionally, through our Charles Lazarus Children's Ability Center, we do have a program called Play Safety, where we are working with local schools to create education around concussion, to provide care before concussion even happens, working with sports teams to better understand how student athletes are performing and how their health is before the season starts. So should they sustain a concussion, we now have even more information to help power through a plan to recovery. So absolutely, through our concussion program here at Mount Sinai, we aim to offer this myriad comprehensive program to address all of the needs of children who experience a concussion in the tri-state.
Yeah, preventative care there. We'll make sure to share some of those resources in the comments below. Dr. Tosto-Mancuso, thanks so much for the insight and stopping by here at Mount Sinai Live.
Absolutely. Thanks for having me, Jimmy.
All right. Find us at Mount Sinai NYC on all major social platforms, as well as our website, with access to the care that you need at mountsinai.org. This has been Mount Sinai Live. We stream smart healthcare information that's simple to understand so New Yorkers can improve their health. Thanks for watching.